Welcome to Pro Webcast News, where we bring you daily industry updates. Today is Tuesday, April 27th, and you're watching the Afternoon Update with Paul Wilson. Today's news is sponsored by Covenant Reliance Producers. We build success stories. For more information, please visit crproducers.com. Now for today's headlines. Federal Reserve Chairman Ben Bernanke today said the country's budget deficit is on an unsustainable path and will soon require action in order to avoid further danger. Bernanke cited the rising cost of healthcare and Social Security programs as two major keys to stemming the ballooning debt. Speaking to the National Commission on Fiscal Responsibility and Reform, Bernanke said, quote, "In the absence of further policy actions, the federal budget appears set to remain on an unsustainable path. Given the significant costs and risks associated with a rapidly rising federal debt, our nation should soon put in place a credible plan for reducing deficits to sustainable levels over time," unquote. The independent panel has been asked to suggest solutions to the deficit problems and has until December 1st to report its recommendations. In healthcare news, a recent report from the Health and Human Service Department concludes that the healthcare overhaul will have the desired effect of expanding health insurance, but will also raise projected spending by around 1% over 10 years. According to the report, the healthcare overhaul will provide coverage to an additional 34 million Americans, but Medicare cuts could drive 15% of hospitals into debt and as many as 50% of Medicare Advantage enrollees out of their plans. While Republicans say the findings support their concerns about reform, Health and Human Services Secretary Kathleen Sebelius said that the analysis reaffirms the Congressional Budget Office's finding that the Affordable Care Act will cover more Americans and strengthen Medicare, while modernizing payment systems, providing free preventative services, and helping to control chronic diseases and closing the prescription drug donut hole. In long-term care news, adult daycare and assisted living costs each grew by 12% this year, compared with 2009, according to an annual survey by Genworth Financial. The survey found that the median daily rate for nursing care in both private and semi-private rooms rose by more than 5%, while the cost of services that allow patients to remain at home rose 3% or less. The median cost of a private nursing home, which is the most costly form of long-term care, rose to $206 per day, from $203 per day in 2009. While this amounts to a national median of $75,190 per year, the costs vary drastically depending on state. For example, private rooms cost approximately $51,056 a year in Louisiana, but more than $200,000 per year in Alaska. Meanwhile, the cost of home health aid services rose 2.7% this year and has climbed by an average of 1.7% annually over the past 5 years. Finally, the cost of homemaker services such as help with cooking or running errands rose 3% to a national median hourly rate of $18. I'm Paul Wilson, and thanks for watching Pro Webcast News. For more in-depth news and features, visit producersweb.com.